Have you ever wondered how your body handles a foreign chemical or medication once it finishes its job? This process is called drug metabolism or biotransformation, and its primary goal is to turn fat soluble or lipophilic drugs into water soluble or hydrophilic compounds so your kidneys can easily excrete them in urine. This chemical conversion happens predominantly in the liver and is broken down into phase 1 and phase 2 reactions. Think of phase 1 as the preparation phase. Here, the liver uses a massive family of enzymes called the cytochrome P450 system to introduce or unmask a polar functional group on the drug molecule through oxidation, reduction, or hydrolysis. Phase 1 reactions act like a biochemical knife, slicing open a handle on the drug so that phase 2 can attach something to it. Sometimes phase 1 can actually activate an inactive drug, which we call a prodrug, like converting codeine into morphine. However, phase 1 can also generate highly reactive toxic intermediates, a classic example being NAPQI, the toxic byproduct formed when you metabolize paracetamol. To neutralize these risks and finish the job, the body relies on phase 2, which is the conjugation phase. Think of phase 2 as a heavy duty disposal truck. It takes the polar handle created in phase 1 and physically attaches or conjugates a large water soluble molecule to it, such as glucuronic acid, sulfate, or glutathione. Glutathione conjugation is exactly how the liver safely neutralizes that dangerous NAPQI byproduct from paracetamol. Once conjugated, the drug is completely inactivated and easily flushed out of the body. Now, the absolute favorite topic for medical examiners is how other substances can radically alter this cytochrome P450 system through enzyme induction or enzyme inhibition, which creates dangerous drug to drug interactions. Enzyme induction occurs when a substance tells your DNA to physically manufacture more P450 enzymes. Because you now have a massive army of enzymes, the metabolism of other drugs shoots up, causing their blood levels to crash and making them ineffective. You can memorize the classic enzyme inducers with the mnemonic GPRS, cell phone, which stands for cresofulvin, phenytoin, rifampicin, smoking, carbamazepine, and phenobarbital. For example, if a patient on the oral contraceptive pill starts rifampicin for tuberculosis, the induction causes their body to clear the estrogen so fast that the birth control fails. On the flip side is enzyme inhibition, where a substance binds directly to the P450 enzymes and freezes them, stopping them from working. This causes co administered drugs to dangerously accumulate in the blood, skyrocketing the risk of toxicity. You can remember the classic inhibitors with the mnemonic sickfaces.com representing sulfonamides, isoniazid, cimetidine, ketoconazole, fluconazole, alcohol binge, ciprofloxacin, erythromycin, sodium valproate, chloramphenicol, omeprazole, metronidazole, and a crucial dietary one, grapefruit juice. If a patient taking the blood thinner warfarin drinks grapefruit juice, the inhibition stops warfarin metabolism, causing their blood levels to spike and putting them at massive risk for fatal internal bleeding. Finally, you must remember that a patient's genetics, age, and liver health dictate this entire process. Slow acetylators, for instance, have a genetic variant that makes them process drugs like isoniazid incredibly slowly, putting them at high risk for peripheral neuropathy, while neonates lack mature phase 2 glucuronidation enzymes entirely. This is why giving them chloramphenicol causes the drug to build up and trigger the fatal gray baby syndrome. Understand how phase 1 primes, phase 2 couples, and how inducers and inhibitors manipulate the system. and you've completely mastered drug metabolism. If you like the video, subscribe to my channel and I'll see you in the next video.